we will begin with Megan from University of Iowa.
Hi, my name is Megan Lindmark. I'm a fourth-year PhD student at the University of Iowa in Civil and Environmental Engineering, and I'm going to talk to you today a little bit about the Smart Chlorinator technology, which represents a partnership between Xylem, EOS International, and the University of Iowa. So EOS International currently operates in Central America. Specifically in 1,500 communities, they have installed passive chlorination technologies. So these passive chlorination devices, also known as chlorinators, are in these 1,500 communities across Nicaragua and Honduras, and they're constructed by the community out of locally available PVC pipes, and they use chlorine tablets to treat drinking water and provide safe drinking water for these communities. EOS then provides circuit riders, which provide monitoring and maintenance to these chlorinators within these communities. They visit each one on a monthly basis and take a chlorine measurement to ensure that these systems are providing adequately disinfected water. However, it can be really challenging for circuit riders to visit as many as 70 communities each month. And conversely, it can be really challenging for community members to go as long as a month in between these visits and not know whether or not their drinking water is safe. So the Smart Chlorinator seeks to resolve both of these issues using water quality sensors. However, directly measuring free chlorine using a sensor is really challenging. Free chlorine sensors are prohibitively expensive and prone to fouling. So our solution proposes to use an oxidation reduction potential sensor and a pH sensor as a surrogate measure to estimate free chlorine. Oxidation reduction potential is the measurement of chemical water constituents potential to provide either an oxidative or reductive process or reaction within drinking water, and disinfection is an oxidation process. So those two measurements are closely related then to free chlorine. We also measure temperature, which is also important for disinfection, as well as tank level, which gives us an idea of how much water is actually being disinfected. Now, in combination, these sensors can be used, like I said, to estimate free chlorine, and then they can then communicate with a data logger, a Xylem Storm 3, which is here in this white box, which then uses a modem on a cellular network local to the area to communicate that data. This is all powered by a solar panel so that it can be installed in rural and remote communities. And this data then can all be transmitted to Hydrosphere, which is Xylem's cloud service. But the ultimate goal is that we can then communicate that data to a cell phone of either a technician or a community member so that they have real-time actionable alerts whether or not chlorine is high enough for safe drinking water, so they can go out and service their chlorinator when it's necessary. And this allows technicians to actually act more efficiently as well by operating more like an ambulance and only responding to communities that immediately need assistance. The system has currently been piloted in Nicaragua with plans to pilot across 5 communities in Honduras over the next year. It is not yet commercially available, though we hope to eventually reach the EOS communities, as I mentioned, and someday be able to partner with other types of chlorinators in other areas in the world beyond Central America. On behalf of EOS International, Iowa, and Xylem, I appreciate you listening to our talk today, and I hope to be able to answer any questions you have either in the live Q&A or my contact information is here. Thank you.
Great. Thanks, Megan.
So yeah, I'm happy to take any questions people have in the chat. And in the meantime, I kind of will fill time with some additional information about those technologies. So as I mentioned before, this is a partnership with EOS International. And if you want to hear more about their chlorinator, the PVC device I mentioned, they will actually be presenting at the tech showcase on Thursday. So you can hear more about the device without the sensors then, but our goal is to optimize and make more efficient the role that technicians have in these communities. So are there any questions?
Yeah, we have a question. How much does a unit cost?
Sure, yes. So because they're not commercially available yet, I don't have an exact estimate for you because we're using research grade technologies. But the goal is to have each unit at the price point of about $1,000, which puts them more in the realm of possibility for these communities. And we would expect that to be paid for not solely by the community, but also by EOS or partially through some kind of government monitoring program of some kind providing subsidies.
Great, thanks. And are there any plans to monitor turbidity to predict chlorine demand?
Yeah, that's a great question. So before installing chlorinators and on a monthly basis, they actually do take turbidity measurements manually in those communities to ensure that the chlorinator is a good fit. And community water boards know to disconnect the chlorinators actually when water is very high. But at this time, that's not included in the smart chlorinator design.
Thanks. Those are all the questions for now. So again, if you have additional questions, feel free to populate the Pathable chat box. And I think we'll move on to the next presentation for now.
Good morning, friends. I'm Lalit Sharma from Sehgal Foundation, India. We have developed this biosand filter in stainless steel body because the conventional filter was weighing too much. It was weighing around 75 kg, whereas this weighed only 4.5 kilogram. And with that, the portability of this filter has been tremendously improved. At the same time, the quality control on the filter body and the system has been improved a lot. So it has got a lid, a diffuser. It has got a spout pipe which goes up to the bottom, a stone grit. On the stone grit drainage layer, there is a separating layer of a smaller stone grit. And in between, there is a copper foil. Because the copper foil has got germicidal properties, over this stone grit, there is a layer of sand as a filter media. Because of the copper foil, the effectiveness of microbial contamination removal has been increased from 98.5% in the traditional filter to 99.99%. We also integrated zero-valent iron technology into this filter to remove arsenic, and we optimized this and successfully removed up to 1650 ppb level of arsenic easily through this filter. Now, this filter is very well suited to the Indian conditions, and people like the stainless steel body. We also developed a design of this safe water storage container. It has got two lid system. One small lid on the top is to collect filtered water, and this bigger lid is to clean the container inside. It has got tap to take out water, and also it has got two handles to carry it easily. Thank you.
Great, thanks, Lalit.
So friends, I'm Lalit Sharma. I will be happy to have questions. And this work was done with the support of Quest Canada. And now we are conducting trainings for other organizations in India to promote this technology.
Thank you. Lilit, can you describe the regular operational and maintenance needs to upkeep the device and the adsorbent filtration materials inside?
Basically, as a filter media, we use the sand for normal microbial contamination, and for in case water is coming with little dust or even turbidity is more than, we recommend to get the water sedimentation done before putting into filter. Even then, if some silt is going in, then the flow rate will go down. And to revive that flow rate, a simple swirl and dump process is recommended, which a user can do themselves. And this process is just put the water into the filter, swirl that, and then scoop out and dump that water, turbid water. And that way the filter revive the filtration rate as it was originally. As far as the adsorbent zero valent iron is concerned, once we put it, it is good for 3 years minimum. After 3 years, it is visibly, we can see the quantity has been reduced, and then we can add more.
Great. Thank you. And could you again explain where the copper filter is placed in the sediment layers?
Pardon?
Could you again clarify where exactly the copper filter is placed?
Okay, copper foil. Basically, copper foil is placed in the bottom because if copper comes in contact with air and water intermittently, it starts corroding. So that is why we kept this in above the drainage layer, below the separating layer, so that it is always in wet conditions and no air comes in contact with the copper. So water before coming out through a spout, it goes through this copper foil.
Gotcha. Thank you. I think we're right at time right now, so we are going to move on with our next presentation. Thank you, Lilit.
Hi everyone, Robert Cooper here from AquaTabs, and I'd like to take just 3 minutes of your time to focus on low cost, innovative infection control for rural healthcare facilities. Regrettably, we've all seen the devastating impact COVID-19 has had on the world, but particularly on our least developed countries. This continues to highlight the critical importance hygiene plays in the fight against this disease. But irrespective of the pandemic, healthcare associated infections have negatively impacted hundreds of millions of people every year. Okay, so what is the problem and how do we solve it? Adequate infection prevention solutions such as clean water, soap and surface disinfection are fundamental to the safety of both healthcare workers and their patients. And yet they have been seriously neglected, mainly due to lack of financial support and in some cases logistical challenges. At AquaTabs, we believe the provision of low-cost, sustainable disinfection can be achieved economically and effectively with our AquaTabs Year in a Box. In one consignment, AquaTabs Year in a Box will provide the complete disinfection solution to a rural healthcare facility or hospital for an entire year. Yeah, that's right. That's water, hand, surface and medical instrument disinfection for the entire year. This all-in-one solution will support in-country commodity allocations whilst reducing sourcing issues. An economical solution that can help reach that last mile. To successfully achieve universal access to WASH by 2030 will require commitment and country representation. By combining the efforts of the private sector with international organisations working closely with governments and local community leaders, we can put in place inclusive, locally run systems to help to educate the community on the benefits of hygiene and encourage entrepreneurial activity, which in turn will foster localised economic growth. The Aquatabs flow is a perfect example. Schools in Nigeria, Kenya, Uganda have all benefited from low-cost drinking water provided by a blended financial support. A collective effort is the only way to provide a positive impact with long-lasting results. This will benefit the entire community, be it healthcare professional and patient. Thank you.
A healthy patient environment requires high-level disinfection solutions. In the developing world, clean water, sanitation, and hygiene are essential to providing quality care and preventing infection. Aquatabs, the infection prevention expert, has launched Year in a Box. A single box provides solutions to stop contamination for an entire facility during a whole year. A ChlorClean tablet is used with water to create an effective solution for surface cleaning and disinfection. Ultraseptin is a water-soluble granulate utilized to disinfect medical and surgical instruments, equipment, and endoscopes. The most effective way to prevent infection is hand washing with soap. And to ensure the safety of water, Aquatabs Flow works as a water purification system that kills microorganisms like viruses and bacteria. Aquatabs, the world's largest water and hospital surface disinfection provider, brings you high-level, low-cost disinfection for all surfaces, instruments, and water for an entire year. Contact Aquatabs today.
That's it, guys. I hope you can. Hope you found that reasonably enjoyable. If you have any questions at all, I'm more than happy to take. I'll just preface it by really saying what we've done with our business is we've tried to blend two sides of our business, which is water purification, and with our medical side of the business as well. So hence Aquatabs Year in a Box. If you have any questions, happy to take them.
Thanks, Robert.
If there's no questions, I'm happy not to take them as well. What we're trying to do, just to give you context also, it is very much a Genesis concept phase, a little bit, probably a little bit more, a little bit less advanced than Megan's concept, but suffice to say, we're trying to find industry partners who will look at a concept, adopt it, trial it, on either a pilot or a scale basis. So at the moment, we're trying to, the offer was socialize the Aquatabs Year in a Box product concept. So if there's anyone out there who you feel, okay, this is a trial product we'd like to get behind, we're more than happy to provide further and additional information.
Thanks, Robert. We do have one question about supply chains for the consumables after the year is up.
Yes.
Do you have any comments on that?
So we operate an in-country led distribution model. So all of our in-country distributors will stock the product, and effectively it'll be a re-up from their local warehousing. Okay.
Thank you. We have time for one more question.
And if we don't, then that's okay too.
And if we don't, we could start our next presentation. And again, if you have questions that come to mind later, feel free to just address the speaker or the product directly in the chat box.
Great. Thank you very much. Thank you.
Thanks, Robert.
Hello, everyone. My name is Bank Scrubs, and I'm excited to present the WellAware project. When we were first creating our innovation, we were thinking about private well contamination in North Carolina and across the globe. Specifically in North Carolina, about 24% of the population relies on private wells, which are unregulated. This places the responsibility of testing and treatment onto well owners, which can be very expensive, and interpreting the results can be very confusing. Now, when we were first developing this, we chose to look into lead, a toxic heavy metal that we're all familiar with, and E. coli, which is a bacteria that can indicate the presence of fecal bacteria and viruses. Our solution to this problem is the WellAware Kit and smartphone app, which is a simple, innovative way for well owners to test their water, understand their results, and get connected to resources. The kit itself contains a compartment bag test, or CBT, which was developed by Aquagenics, and a lead testing strip. The CBT is basically a plastic bag with different sized compartments that, when filled, based on the number of compartments that change color, you can estimate a most probable number of E. coli in a water sample. The lead testing strip is a lateral flow immunoassay designed to indicate if the concentration of lead in a water sample is above or below 15 parts per billion. If the concentration is less than 15, the left line on this strip is darker. If the concentration is greater than 15, the right line should be darker, or they should be the same color. However, the strips can be really tough to read, and 15 parts per billion is a pretty high cutoff, even if it is the EPA limit. So the app, developed by Crosscom out of Durham, reads and explains these test results and connects users with local resources such as county health departments. The app has two main functions. First, it provides users instructions on how to use the CBT, and using a machine learning approach that's still under development, can read the bag results and provide a most probable number as well as a risk category. These images show examples of the CBT, and it shows that while they're not necessarily that hard to read by eye, there is some variance in color, and this really just takes the guesswork out of the method, and also provides users with resources and next steps. For the lead testing strip, we use a colorimetric detection approach, which, long story short, we've developed a method that can turn these lines in here into numbers, and we can use those numbers to predict lead concentrations based on a photo. And then we will be able to connect users to local resources like their county health departments for additional testing and treatment based on the result from the CBT and lead strip. How well does this work? So first, the compartment bag test was
All right, sorry guys, I think we're experiencing some technical difficulties. Manal, could we replay from the middle?
I'm sharing the thing again, 1 second.
Thanks for bearing with us, guys.
If it's too much of a pain, I also have the presentation. I can just share my screen.
Right now.
Okay, you can if you want. I was just making sure.
Feels like that'll probably be easier, so I'll just go ahead and do that.
Thanks, Banks.
Yeah. Sorry. All right, so y'all see everything?
No, go back to
Yes.
what this is.
This is it.
Oh, okay, great.
So the compartment bag test, like I was about to say, was developed by Aquagenics and validated against the gold standard. So we know that it works. We haven't had any results on the machine learning approach yet because it's still under development, but it works. The lead strip, we have proof of concepts done with deionized water, which is what we're seeing here, with pretty high sensitivity and specificity, hanging out above 90% for the most part. And we're currently working with well water now that we've got ICP-MS set up and ready to go. So that'll be coming up soon. Next steps, there we go. We're hoping to finalize the prototype November, December of this year, pilot it early next year and make adjustments based on our piloting, and then roll it out early to mid 2022. Thank you, everyone. If you have any questions after this, you feel free to reach out to Michael Fisher, this guy, through email, or go to our website, wellwarenc.com or crosscom.com, who is the developer. Great.
Thanks, Banks. And thanks
Yeah.
for being flexible on
Yeah,
the
no worries.
fly. We have a couple minutes for questions. And I do have one question to start us off about the way that the user receives results from the lead test. Is that a presence absence indication, or is it quantified?
It's roughly quantified into risk categories. We don't have the exact categories hammered out yet because that's going to depend on what we're most able to predict accurately, but it should give basically a non-detect, we can't tell the difference between this and the background, a Low amount, maybe check again, talk to your health department, get a lab test done. Sort of a middle level, like, hey, got some problems here. And then also really high, like, this is really high lead, talk to your health department, maybe buy some bottled water.
But what's really innovative here is the test strip itself was designed to be presence absence, and it doesn't do that very well. It's hard to read. And what the app enables using computer vision is it takes that not very good binary outcome and turns it into a quantitative measurement. And so we're able to say, hey, are you in the sort of 0 to 1 or 2 parts per billion region where we can't distinguish from background? Are you in that sort of 2 to 10 parts per billion region, which is below US regulatory action levels, but above what you'd really want to be drinking? Or are you in these higher ranges that are potentially above WHO guidelines or above EPA action levels, where you want to run, not walk to your local health department to take action? And so that sort of red, yellow, green information tends to be more useful to well users than 7 parts per billion, which, sort of, okay, what do I do with that? And the other thing that the app does is it's really a one-stop shop, so that it will link users to contact number for their local health department, so they can reach out to an environmental health team and take action if needed. But the other unique feature is that the lead and E. coli data are stored only on the user's local device, because a lot of people are concerned about, well, is this going to affect my property values or whatever? And so they get the information they need, but also there's privacy unless they opt in to a citizen science note to share the data. That answers your question?
That answers, and then some. Thanks, Banks and Mike.
Yeah, and just a shout out again to Crosscom. They've done wonderful work sort of developing this app to really leverage what AI and computer vision can do to take these sort of pretty robust tests, but make them much more user-friendly for well users in North Carolina and beyond.
Great. Thank you. And with that, we will move on to our next presenter.
Hello, my name is John Chekalochak, and I'm QIAGEN's Business Development Manager for Digital PCR in the applied testing market. Today, we will discuss a turnkey workflow for the extraction and quantification of SARS-CoV-2 from wastewater. The products discussed today are intended for molecular biology applications only. These products are not intended for the diagnosis, prevention, or treatment of a disease. QIAGEN and GT Molecular provide reliable partnerships and innovative solutions for labs performing wastewater-based detection of SARS-CoV-2. For sample disruption and extraction, this includes our all-prep power-viral DNA-RNA kit with effective inhibitor removal technology, which can be automated in our QIAcube Connect system. Digital PCR-based detection with the QIAcuity system and GT Molecular's validated SARS-CoV-2 wild type and variant assays allow for a simplified dPCR process with strong guidance and compliance with the CDC news reporting standards. When we consider the two common options for PCR-based detection of SARS-CoV-2 in wastewater, we see that qPCR, while broadly accessible, is reliant upon externally validated standards and routine standard curves, and can be quite sensitive to inhibition from contaminants commonly found in the background matrices of wastewater samples. Nanoplate-based digital PCR does not require standard curves, has superior precision, reproducibility, and a high tolerance to inhibitors. The QIAGEN QIAcuity digital PCR system is ideal for the detection and quantification of SARS-CoV-2 due to 4 main features. 3 different instrument configurations, a 1, 4, and 8 plate system, allow for labs to select the instrument which meets their throughput needs. The robustness of digital PCR affords for precise, absolute quantification of SARS-CoV-2 without the need for standard curves and a high tolerance to inhibitors. With 5 detection channels, you can have multiplexing capabilities of 2 or 5 plexes per well. Simple and rapid plate-based workflows take the user from sample to results in under 2 hours. The workflow of the QIAcuity dPCR system is very similar to that of qPCR. Users pipette the prepared reaction mixture into the nanoplates, apply a seal, and then place the plate onto the QIAcuity instrument. Once on the instrument, no further manual intervention is required, as the QIAcuity will automatically perform sample partitioning, amplification, and detection in this all-in-one platform. Regarding assays for this turnkey solution, the GT Digital SARS-CoV-2 wastewater surveillance kit provides validated molecular reagents for the QIAcuity system. The N1 and N2 region of SARS-CoV-2, along with a bovine coronavirus matrix recovery control, are tested in a single well in a triplex assay. An additional assay for PMMOV uses a fecal load indicator is supplied as a simplex reaction in the kit. This allows for multiplex detection of these targets. Furthermore, all CDC and news required controls are included in the kit. These are manufactured under CGMP conditions, fully wet lab validated, and designed with CDC and news compliance reporting in mind. When we look to the upper right at the observed unexpected copies per reaction across the dynamic range for N1, N2, B codes, and PMMOV, we see excellent linearity across this dynamic range. In summary, this workflow allows laboratories to perform accurate and precise detection of SARS-CoV-2 from wastewater samples. It does this by providing a complete turnkey solution for the extraction, detection, and quantification of SARS-CoV-2. For those labs that require, we have expert support and guidance all the way from sample extraction through data interpretation and reporting. I would like to thank you for your time and attention today.
QIAGEN.
Sample to insight.
Thanks, John.
All right, thank you.
And oh, sorry, cut you off.
Oh no, please go on.
I was gonna say, as we wait for questions to trickle in, I have a question. Do you have any additional variant assays available for QIAcuity?
Yeah, so very soon we'll be launching in partnership with GT Molecular a number of variant assays for SARS-CoV-2. So that's going to be comprised of 3 different multiplexed reactions, so multiple targets per well. One would be for the alpha, beta, and gamma, so that would be 5 targets. We'll have a delta and delta plus 4 target panel coming, as well as a lambda, Florida, and Mexico emerging virus panel, which would be a 5-plex. One of the nice things about these is all those panels will include positive controls for all the variant kits, in addition to the wild type as well.
Thank you.
So I'm going to speak a little bit briefly more about this turnkey solution. So one of the great things about this digital PCR solution for wastewater monitoring is that any lab who's familiar with qPCR technology should be very comfortable and familiar in picking up this workflow and operating it, in that it's very similar to the overall touch points and processing. So for any lab that currently does molecular testing, it's quite a nice transition over. And then additionally, what we described here today is for the monitoring of SARS-CoV-2 from wastewater, but this is applicable to any nucleic acid target from infectious disease or source microbial tracking standpoint. So.
Thanks, John. I think we can go ahead and move forward with our next presentation now.
Sorry, it froze. I'm going to restart the video 1 second.
No worries. Okay, then while we have this time, John, could you provide a high-level summary of how dPCR is able to tolerate inhibitors?
Yeah, absolutely. So if we think about real-time qPCR or really conventional PCR, what happens is there's probably a 1,000,001 different components that pull through your RNA or DNA extraction from wastewater or any sample matrix that like to inhibit the Taq polymerase that operates to make more and more of your copies of DNA within that biochemical reaction. What digital PCR does is, one, it partitions out your target from a lot of the inhibiting components, but really the primary effect of how it stops inhibition or is less reliant upon it is because we care about an endpoint reaction. So we don't care when one individual partition became positive, just that it is positive relative to the negatives. So that gives us a lot of freedom to have reaction inhibition within any given well.
Makes sense. Thanks.
You're welcome. Thank you.
And now we have our next presentation.
Hi, my name is Katya Cherukmeli, and I'm a postdoctoral scholar at the University of California, Berkeley with Dr. Amy Pickering. Today, I'm going to tell you about the Venturi passive chlorinator. This device was co-designed by engineers in Bangladesh, Kenya, and the US almost a decade ago. It's very simple to use, versatile, and affordable. The Venturi can automatically and precisely dose chlorine at the point of water collection without requiring any electricity, user input, or moving parts. In addition to its low user burden, the Venturi is also compatible with a wide range of flow rates, enabling it to work well even in regimes that are intermittent flow. In addition, the Venturi can be refilled with widely available liquid chlorine, such as dilute bleach or chlorine generated through electrochlorination. We estimate that the large-scale cost of the Venturi when manufactured at scale is about $35 per unit. Thus far, our efforts to implement passive chlorinators in the field have reached over 20,000 people worldwide. A randomized control trial conducted in Dhaka, Bangladesh indicated that inline chlorination decreases childhood diarrhea prevalence by 23%. Our research also demonstrated that landlords were able to incorporate the monthly operational cost into their rent prices. Additionally, in Kisumu, Kenya, our research demonstrated effective demand amongst kiosk owners who were willing to pay up to $250 for leasing to own the Venturi and for a chlorine refill service. Additionally, over 2/3 of the customers at the kiosks in Kenya reported a preference to purchase water treated by the Venturi as opposed to untreated water. Here you can see some of our additional citations demonstrating our field effectiveness and tests. Our pathway to scale is identified as follows. We have already established some critical scaling and implementation partners, and we are continuing to raise funding to optimize the design of the Venturi so that we can enable in-country mass manufacturing with minimal labor using injection molding. We want to evaluate a hybrid financing model, identify operation and maintenance barriers, and to characterize the true costs of deploying a device like Venturi. In addition, we're interested in measuring the effective demand for the Venturi in institutional settings such as schools and healthcare facilities. Our current work demonstrated in this table is to estimate a global target market for passive chlorination using data from the multiple indicator cluster surveys and the joint monitoring program. Our global estimate of the population using drinking water sources that are both compatible or potentially compatible with passive chlorinators and currently microbially contaminated is at about 2.1 billion people. Just to clarify what we mean by compatibility with passive chlorinators, in this chart on the right here, I show you how we characterize different drinking water sources as compatible, potentially compatible, or incompatible with passive chlorinators. If you're interested in this work or the device, please visit passivechlorination.com or feel free to email us. Thank you very much.
Thanks, Katya.
Yeah, no problem. I will open the chat in case anyone has questions. Otherwise, I'll sit here.
I think that was a lot of information in a short amount of time. I have some interest in the operational and maintenance part, and I know that was one bullet that was it seemed like it was in progress, but do you have any comments about possible issues with operation and maintenance?
Yeah, that's a good question. So the primary need on the user side, whether it's like a community scale operator or a household scale user, is to eventually refill the chlorine tank when you can visibly see that the chlorine has been depleted. So for about a 1 liter capacity tank, it can treat 12,000 liters of water passively without electricity or user input or moving parts. And so that frequency of chlorine replacement is something that can be taken into account through like a hybrid financing and business model where you involve local institutions and groups to help with replacing the chlorine. Other than that, in terms of maintaining the actual internal parts of the device, I would say that if the water supply changed for some reason and all of a sudden you're having higher iron levels or something that could cause clogging or even higher salts, you might have to do some backwashing or open it up and maintain it that way. But in terms of regular operation and maintenance needs, it's pretty minimal. Someone asked for the citations. All of them can be found on the website that I mentioned, passivechlorination.com, and additional information that I presented in the talk is also available there. I can put a link to that here.
Thanks, Katya. And if you could put a link in the Pathable chat box as well, that would be helpful.
Got it. I'll do that right now.
Thank you. We will move on to our next and I believe our final presentation. Again, if you have any questions from any of the previous presenters, please feel free to populate that chat box. So now we have Lynn Liu.
Hello, my name is Lynn and I work with HappyTap, a social business focused on building a new normal in hand hygiene. The innovation we want to showcase at this year's UNC Water and Health Conference is hand washing within reach, with the help of modular next generation hand washing sinks. While we have invested years in the research and development of a particular set of products, the innovation we're championing during and after this pandemic is a mindset shift that users are able to comfortably, conveniently wash their hands with soap whenever they need. And this idea is not innovative. Hand washing with soap is long proven. And since the beginning of the pandemic, we're all being asked to wash our hands more often and in more locations. However, if hand washing facilities are far away, or if hand washing is hard to do, we will continue to not wash our hands at critical times, let alone more often or in more locations. So, we want to ensure that we follow the science on hand washing behavior change. If convenience is the best predictor of behavior, then making hand washing as convenient as possible is our best chance to actually change hand washing behavior. And HappyTap is championing the new normal for hand hygiene, and this new normal must begin with changing our collective expectation on how accessible and convenient hand washing is for everyone in low-income schools, clinics, and homes. And a key piece to this hygiene new normal then is to deploy modular portable sinks that don't have the usual barriers to hand washing, piped water, and fixed location construction projects. And the HappyTap products itself, sometimes referred to as Labobo in some countries, was designed and developed by Watershed over a decade, a wash market development NGO that operated out of Cambodia and Vietnam. And today, HappyTap is available worldwide. Simply reach out to us at happytap.net. In the US and UK, you can purchase 5 packs online. And that concludes my presentations today. Thanks for watching. Cheers to a hygiene new normal, and happy UNC Conference 2020. 2021.
2021. Thanks, Lynn. As we wait for some questions to trickle in, I have a question. Could you provide an example of how HappyTap and other partners have implemented hand washing within reach?
Yeah, thanks, Amanda. I know we say hand washing within reach, and all it means is that can kids wash their hands in schools, or can patients and healthcare workers wash their hands as soon as they need to, rather than having to wait and go find a hand washing station. So one example would be UNICEF in Cambodia last year, when COVID was just beginning to hit the news. They worked really fast to put together safety kits for all schools. That's over 10,000 schools in Cambodia, and they included HappyTaps as the hygiene station, where they said, you know what, we don't have time to be building hand washing stations. What can we do now? And that means then that those kids in each classroom would have a hand washing station. And frankly, I don't think we distributed enough for there to be hand washing within each classroom even. And I think that means that we have a lot of work to do where you have a classroom of 20, 30 kids, then they should have a station within reach in the classroom. So Cambodia would be one example.
Gotcha. Thanks.
Yeah. And, you know, come to think of it, if there aren't any other questions right now, another example would be MREF deploying Happy Taps. They distributed 2,000 Happy Taps to rural health clinics in Kenya at the end of the year last year. And they also partnered with MapWash, which is an organization that does monitoring for sanitation hygiene projects. And they put sensors in the product to use them to measure hand washing behavior, which is really notoriously difficult to do. So that research will be forthcoming this year. So we're excited to learn more about hand washing by having people able to wash their hands more. That's pretty cool.
And with the deployment of Happy Taps, was there a lot of training involved for the users, whether
That's
it's students or clinical settings? Sorry.
Great question. No, there is no training with Happy Taps with like there shouldn't be with portable hand washing stations. You should be able to just set it up. There's no real connection, fill it with water, put soap in the place where it's clearly designated for soap. Our product is designed to sort of nudge these behaviors where it looks weird if there isn't soap in that clearly empty space for it, things like that. And I think for the audiences at UNC, the big question is about maintenance and sustained use over time, right? So like no single product is going to be able to do that. But the good thing is that you don't have to call a technician for setup or maintenance over time. You just have to make sure that there is a good rotation for cleaning in a school or clinic, as you should anyway. And you would then include hand washing within that. And it's shocking that it's not already a part of the maintenance rotation for staff. So thanks for that, Amanda.
And thanks for those answers. That was really clarifying. We have about 9 minutes left of this session. I'm going to invite the audience to again populate the chat with any questions about any of the presenters, or presenters if you wanted to ask each other questions. Feel free to do so. Otherwise, I think we may be able to have an extra couple minutes of our afternoon. I think we could conclude early, which is cool. Rarely happens in conferences, right? So thanks everyone for joining this afternoon. We have another tech showcase on Thursday during the lunch session. I hope you enjoy the rest of your day and the rest of the conference.
Thank you.
Thanks,
Bye, everyone.
Bye-bye.